you're suffering from lateral pelvic tilt with one-sided weakness and it creates this pressure down, usually right knee pain and hip flexor weakness. Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. Join me with my friend Gabby, who's suffering from anterior pelvic tilt from my previous video you can check out over here, as well as she has having now pain down her right side, especially her right knee, because she has a lateral pelvic tilt where her right pelvis is lower than the left. So that creates this pressure on her right knee, and we can assess her today. And how do we realign using muscle energy techniques, which means we're going to utilize our muscles to activate that weakness, to lift that right side weakness for her. And for me, I have a history of left side lateral pelvic tilt, which means my left side is lower than my right. So get your mat ready, a foam roller to help engage your deep core muscles, your pelvic floor, and to help elevate your tight hip flexors. Yes, this is my beautiful technique that I use a lot in my courses and in my clinics. And then for Gabby, she has some ankle weights to engage her weak core. But for those absolute beginners, you can still join me even without ankle weights or elastic band. And we're going to use a foam roller. And if you don't have a foam roller, you can use rolled towels or soft pillows to place on your pelvis. So let's assess Gabby now, as she's going to lie on her back. And I'm going to show you what is lateral pelvic tilt first, so you understand how to check yourself at home if you have that one-sided weakness and pain. And as we can see on Gabby, so as you can see her pelvic alignment, press your iliac crest over here, Gabby. So this is how you can check your pelvic tilt. So use your thumb on top of your pelvic bones. Here is the iliac on top. And then this is her right and this is her left. And then once you connect your thumbs together to the midline towards your abdomen, so making sure you go straight and don't move, keep it going straight. Now that's how you see her area. As you can see closer, again, let's try it again. Her iliac crest alignment from her right and left, and connect. And that's how much is her connect. So her right side is lower than her left. And then if you look at her legs, her feet, it looks like she has a functional leg length discrepancy. It looks like her right foot is longer than her left. And earlier, her left is higher than her right. And then, if you can check it at home, bend your knees, Gabby. You can start bridging first. Bridge up, lift your hips up, and then down. And you can check again with that glutes activation. Sometimes it realigns, but for her, it's still the same. Her left side iliac crest is higher than her right. So at home, as I said, check it, your alignment on your pelvis. And the leg length, it doesn't mean your bone is longer on one side. It's just the pelvic tilt is lower on your right, so it looks like it's longer. So now we can sit up now, Gabby. That's why I have the foam roller, because most of my patients are very weak on their hip flexors and they're also very tight. And no matter how much you stretch your hip flexors, it's not going to lengthen without the strength. This is for Gabby, and she has the ankle weights now. So the first part we have to do is to engage isometrics. Isometric means you're strengthening the muscles without any muscle movement. Just holding that position. Okay, my friends, let's begin the program now. I have elastic band around my thighs. Gabby has the ankle weights to challenge. Elastic band is for closed kinematic chain. Ankle weights is open kinematic, which means constant resistance. Elastic band is the further I resist, the more it challenges. For her, I want to strengthen her right side. As we assessed earlier, her right side has the tilt going down. Mine is my left side. So I want to lift my left. So I'm going to show you guys one left side weakness. And for those, when you assess yourself, what we just demonstrated earlier, then you do whatever your weak side, one side weakness is. So for Gabby, she's going to focus on her right side to lift the tilt up. And for me, it's my left side. So as you slowly lie down, interlock your fingers behind your thighs, slowly roll down one vertebrae at a time. Exhale. Gently place the foam roller under your pelvis. As I said earlier, if it's a lot of pain, use a rolled towel, soft ball or pillows, or very soft foam rollers. So for absolute beginners, my recommendation, making sure there's no pain when you're in this elevated position. So far, so good, Gabby, on your pelvis. And as I said earlier, no pain, no gain is not my belief. My belief, pain is the one that tells you something's off. If you have SI joint dysfunction, low back pain, and you can do this also straight down on the mat if you can't tolerate any elevation. The purpose of the foam roller, as I get asked a lot, is to help elevate weak, tight hip flexors, at the same time pelvic floor, to help engage it beautifully. So let's take a deep breath first through your nose as we practice to warm up our core muscles. As you inhale, expand your rib cage. And I'm rising up my abdominal muscles to give space on my pelvic floor, and my diaphragm lowering. And then as I exhale, I zip it up from your lower abs towards my navel. Inhale again. Exhale, zip it up. And after that beautiful activation, now we can challenge. So for Gabby, she's gonna lift her right knee up to tabletop with her toes pointing away. For me, as I said, is my left side. So now I'm going to feel my resistance of my elastic band around my knee already. Toes pointing away. I'm grabbing my top of my knees, both hands. And if you're rolling off the foam roller, you can hold one hand on the foam roller, one hand on top of your knee. Depends on how you can be stable on the foam roller. And then breathe in, breathe out, gently press against your thigh without moving your knee. So this is isometric. Isometric means you're strengthening it without movement and keeping your knee in tabletop position, 90-degree bend, knee level to your hip, gently press, zip it up as you breathe out, and then slowly inhale, lower it down. We have 5 more to go. Breathe in, lift to tabletop, exhale, gently press. And I'm feeling some deep ache on my hip flexors. Can you feel that, Gabby?
Yeah.
So that's a sign that's your weaker side, to help elevate and lift that tilt that she's having for a while now. As she's also having anterior pelvic tilt posture, which is an increased lordosis for spine with lateral tilt down. And you can check out my previous video over here to learn more on anterior pelvic tilt, which is increased lordosis of the spine. Inhale as you lower your foot down. Exhale, lift again and press against your thigh. My recommendation is to start 5 repetitions for absolute beginners, then slowly progress to 10 repetitions. And exhale. And you're going to feel that ache. Sometimes it goes all the way to your knee, right, Gabby? And that's why she's having knee pain in that area as well, because every time she walks, because that side is the lower side, she's stepping more pressure on her right foot all the way to her right knee. And if she's standing a lot, that's when she's feeling more pain. Right, Gabby? Last 2 more to go, my friends. Inhale, exhale, lift, and press against your thigh. And for me, it's my left side. This is where I have more pressure from my previous injuries. Last set, my friends. Inhale, exhale, press. With proper breath work and engage. And now, let's go to the other side. So after lifting my left side, and for Gabby is her right, she's gonna lift her left knee to tabletop again, and my right side. This time I wanna lower my right side, and for Gabby, she wants to lower her left for that tilt to be more balanced, interlocking her fingers, placing her hands behind her thigh, and gently extend this time. So I'm pushing my foot away from my knee, but keeping that 90-degree bend as she breathes in. Exhale, zip it up, core engage as she slowly push out towards her thighs. And then down. So this time she might feel some ache on her low back or just nothing. So far, there's no weakness there, right, Gabby? So for me, I don't feel anything on my right, but that's still important. Even there's no sensation. As she breathes in, breathe out, press against my interlocked fingers, and then down. So I'm holding it 3 to 5 seconds hold. And as I said, you can hold it longer, up to 10 seconds as you get stronger every single day. You can do this every day to readjust your posture, especially if you're sitting a lot, standing or walking, and you want to make sure you start in the beginning of the day as well as the end of the day if you can do twice a day. 2 more to go. Inhale, exhale, press. Last set, my friends. Breathe in. Expand your rib cage. Exhale. Bend to tabletop. Interlock your fingers and then press. So now I'm really feeling it inside my hip joint. Can you feel that, Gabby? Even though you're good side, you'd be surprised it needed some love. Now, after realigning your pelvis, you can readjust the foam roller, making sure it's not rolling down. And that's a sign that you really need to strengthen the stabilizers of your pelvis. We're gonna lift both legs up now to tabletop, and this is more of a challenge. You can hold on both hands on the foam roller for absolute beginners, or for those who can let go now, make a fist, place it between your thighs, and we're gonna glue them together. So you wanna make sure you glue them as you press your fisted hands between your knees as you breathe out. And hold it for 5, 4, 3, 2, and 1, and then you can relax down if you can't hold it too long. We have 5 more to go. Breathe in, breathe out, lift to tabletop, both knees. Place your fisted hands between your knees, and if you can't handle the pressure between your hands, you don't want to hurt your hands, you can use soft ball or pillows and squeeze the pillows, or even without anything, and squeeze your knees tight together. But it's nice to have that space to keep that knee and hip parallel together, and constrict and press, and then down again. We have 3 more to go. Breathe in, breathe out, lift, zip it up, and then squeeze. So the purpose of the gluing together, do you know that the joints on your SI joint, your pelvis joints, 3 bones on the left, 3 bones on the right, are the same joints like your teeth. So it's the gomphosis joint. Gomphosis is a joint that's a little bit movable, but it's not like our elbows or shoulders that's more range of motion. That's why our teeth, you can still move them around with braces. So the same thing, we're putting brace on our pelvis. Have you heard about that, Gabby?
No, I haven't.
Now we know our SI joint, our pubis symphysis, we're gluing them together by doing this, targeting your hip abductors all the way to your pelvic floor, and then squeeze. Last set of gluing them together after that beautiful alignment. That's why I believe in moving our muscles, we can readjust our joints. Last squeeze. Well done. And after gluing them, engaging your hip abductors. Now we're going to engage your hip abductors. Tabletop position again. This time you're going to place your open palm hands outside your thighs and gently press against it without moving. Isometrics. As you breathe in, breathe out, press. Squeezing your core in. And then just 1 deep breath in and exhale. It's like 5 seconds hold. We have 5 more to go, my friends. Tabletop, breathe in, breathe out, press. Squeeze your core in. And then down. Inhale. Exhale, lift. 3 more, my friends. And then down. 2 more. Breathe in. Breathe out. Squeeze. Almost 2 deep breaths if you like. Last set, my friends. So far, so good, Gabby. You're getting tired, right, on your pelvis? And then squeeze. And after beautiful gluing the outside of your hip abductors, your adductors, your pelvic floor, hip flexors, realignment, now we're going to strengthen now. We're going to do some lovely deep core activation, great for postpartum or menopausal women. Now lift your feet up. We're going to gently tap 1 foot at a time. Eccentric control. So the beauty about this, as you exhale and tap gently, just your toes, don't plop your foot. You don't want to strain your back. Inhale back to tabletop. Exhale, switch to the other side and tap. The purpose of the foam roller, it gives you beautiful eccentric control, lengthening the tightness of your hip flexors. There's more range of motion to lengthen and strengthen this time. And then the slower, the better. We're not going to speed it up. We want to have more control on our body as we tap, because that's how we control our breath work. Slow and steady. Reconnect to your pelvic floor and your deep core muscles. Breathe out as you tap. 5 more, my friends. Inhale, exhale. Three more to go. So far, so good, Gabby. Feels so good, right? So for her, she has the ankle weights. It's more constant resistance for her. For me, the further my foot is tapping, the more I'm getting the resistance. So as I tap my left foot, I'm feeling it my right anterior part. And then as I tap the other side, I'm feeling at the back of my thigh. Beautiful. After that beautiful tapping, now you can press again for your hip flexors. Press against it. So we're doing concentric isometric hold for your hip flexors, and then gently extend one leg at a time as you exhale, toes pointing away. And then as you go down back to tabletop, you dorsiflex, pull your toes pointing towards you as you gently go back to tabletop position. So both feet, ankles are dorsiflex before you begin with, and then switch to the other side and then tip your toes away as you lift. Dorsiflex, toes pointing you as you go back to tabletop, while at the same time pressing against your thighs. So you're going to feel that burn. Yes, keep pushing against it, Gabby. Toes pointing away and then extend. And then once you lock your knee, if you can, dorsiflex and then bend. And then switch to the other side. Dorsiflex before bending. All at the same time pressing against your thighs. We're combining a lot of gluing. At the same time, eccentric and concentric strengthening of our thighs, hamstrings, and calf muscles. Isn't that beautiful, Gabby? You can feel a lot of sensations right now. 4 more to go. So because Gabby is having that tilt towards the right, her right knee is getting more inflamed if she's standing a lot, right? So that's why this is a good way to decrease inflammation, lengthen, strengthen, and readjust the alignment of her pelvis so she's more balanced. 2 more, my friends. And for me, as I said, I'm opposite of Gabby. My left side is my weaker side. And everyone is unique. That's why you have to find out which side is your tilt. And if you don't have a tilt, you can still join us. Well done. After that beautiful lengthening gently, now we're going to lengthen our hip flexors. We're going to extend one leg. So I'm extending my left leg first with your knee straight. So if the elastic band starts rolling up, that's fine. Keep your knee locked, Gabby. And then hug your right knee to your chest. So place your both hands on top of your knees if you don't have knee pains for a gentle stretch. Can you feel that stretch? As you breathe in, toes pointing away, exhale, lift, straight leg raise towards to the heavens. And then once you reach to the heavens, dorsiflex, and then exhale again, all the way down. So as you tip your toes pointing away, breathe in, expand your rib cage, exhale, lift it up. And then once you reach it up, zip it up, and then inhale again, dorsiflex, exhale down. You're going to feel that beautiful lengthening of your deep hip flexors. Inhale. You can tap the floor if you need to for absolute beginner. Exhale, lift, dorsiflex, and then down. 3 more, my friends. Inhale. Exhale, lift, dorsiflex down. 2 more, my friends. Last set. Inhale. Exhale, lift. Well done. Now we're going to switch to the other side. I'm going to hug my left knee now. Extend my right. I'm going to feel that beautiful hip flexor stretch. Can you feel that, Gabby? It's tighter on your right side, right? So for her, it's her right side, mine is the left. Inhale. Exhale, lift. And then inhale again as you dorsiflex, toes pointing you. Feel that beautiful stretch down to your hamstrings. Exhale down. Inhale, tip your toes and lift. Inhale, exhale down. 4 more, my friends. We're almost done. To realign your pelvic alignment with the foam roller. If you have pelvic floor weakness, postpartum, perimenopausal, or menopausal women, you can always revive your pelvic floor health. And this is great also for anyone with bladder incontinence to level your lateral tilt. That helps your bladder not to spill in one side. Last set. Well done. And we're going to close the program with a beautiful butterfly stretch. Feet together, bend your knees apart. Opening that hip flexors and your hip abductors and take deep breaths in this position. It's beautiful with the foam roller. Breathe in, breathe out. 2 more deep breaths in. Squeeze your core in as you breathe out. Last set, inhale. And exhale and slowly place your knees together. Slowly roll off the foam roller and slowly get up. And that's it. I'm hoping you enjoyed this lovely deep core activation for lateral pelvic tilt if you have low back pain and pelvic floor weakness. And I just opened my back masterclass. It's going to be closing soon, so don't miss out for my amazing course. Click the link on the description for an 8-week course. If you have lateral pelvic tilt, low back pain, let's find out the root of the problem so we can fix your core strength weakness, even postpartum, or for those who has had their baby many years ago. It's not too late if you have chronic pain. And for those women postpartum and you need that help for your prolapse, vaginismus, or any trauma on your pelvic floor, diastasis recti umbilical hernia, then check out my Revive Pelvic Floor Health Core Rehab. Check out on the link on the description below, and also have my Absolute Beginner's Core Back Immersion membership class. You can check out also here. You can also access it directly in my description below. Thank you, Gabby, by the way, for joining me today again. She's a lovely nursing student graduating next week. I'm so proud of her. She just finished her associate degree and she's only 19. Congratulations, Gabby, for graduating beautifully with high honors. And until my next video training, see you in my next video training. Always remember, be safe, be well, and healthy you. Bye!